This next adjustment is a supine covered thumb proximal clavicle for an S to I glide restriction of the SC joint. For this adjustment, Doc, you're going to be at the head of the table here. You're going to take your outside hand, give it a thumbs up, and I want you to put that thumb straight on the proximal clavicle. So pay attention to your hand placement. My fingers are coming over onto the shoulder. I've got big hands, so I'm able to do that. If you've got smaller hands and you're worried about hitting a breast tissue on a female or something along those lines, please curl your fingers in so that you do not do that. So that thumb contact is on the proximal clavicle. Your inside hand is going to reinforce that thumb contact, so I'm going to use just a slight hypothenar contact on that thumb. And then what I'm going to do is I'm going to take this contact that I've established here, and I'm going to push. So you'll see the GH joint go down as well. I'm pushing everything straight down so that as I apply force, I can go straight superior to inferior with my force. Now, on some patients, this contact is going to be tender or painful. A modification you can do is still have that contact over that patient's shoulder here, but if you come in with just that hypothenar, sometimes just that hypothenar is going to be enough that it is a little bit more comfortable for that patient. One thing to notice here is that as I've got that contact, my fingers are going straight up. They're not laying on or resting on my patient's chest. Okay? So this adjustment was a supine covered thumb proximal clavicle for S to I glide restriction of the SC joint.